go.
Knock, knock, knock. Hello, my name is Whitney. I'm going to be a nurse for today. I'm going to go over here and perform hand hygiene and wash my hands. Okay, I'm going to close the door for privacy. Can you verify your full name and date of birth for me?
My name is Shania Evans. I was born July 19th, 2008.
Okay, perfect. Okay, so today I'm going to be performing a head, ears, eyes, nose, and throat assessment. Is that okay with you?
Yes.
All right, so first off, we're going to start off with her head. I'm going to go ahead and examine, look over her scalp, feel around her head. I don't see any lesions, no any lesions or bumps, masses noted anywhere. Okay, so now we're going to go ahead and we're going to do a vision acuity test. So I'm going to have you stand up for me, and we're going to use the Snellen chart, and I'm going to have you read from the Snellen chart for me, okay? So we're going to start with the right eye, okay? I'm going to have you cover your left eye with your hand. Cover your left eye. Since the patient wears glasses, she will need to perform this test with her glasses on. So I'm going to have you read down as far as you can see.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, B, L, O, P, 2, 0, D, B, F, P, O, 7, B, C.
Okay, now we will do the same thing with the left eye now, and I will have her read as far down as she can with covering the right eye this time.
E, P, F, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, B, L, O, P, Z, D, D, B, F, P, O, 7, B, C.
Okay, so the patient actually reads a 15 out of 20 results that we got for her. I will also have her read with both eyes, but for the sake of the time of this assessment, we're just going to stop with her just reading from each eye, but normally we will also have her read with both eyes. We're going to have you take a seat for me now. Okay, so now let's go ahead and finish your eye examination. I'm going to have you take your glasses off for me. Okay, so we're going to... All right, gonna shine this light in both eyes here. Okay, so pupils are equal and reactive to light. All right, and then I'm gonna follow that. Okay, good. And accommodation. So now we're gonna check her ocular movements. Just follow my pen light with your eyes without moving your head. Okay, good job. All right, so I'm gonna also just pull her eyelids down, and I'm just gonna check her conjunctiva, which is nice and pink. I'm looking at her sclera, which is nice and white. Also now, we're going to go ahead and move now down to the ears. So I'm gonna pull her pinna up and just check into her ear here, and normal. I noticed normal drainage. There's no lesions. Her cerumen is nice. Earwax is within limits. I'm gonna pull up this ear and check as well. All right, so I'm noticing normal drainage, and then we're gonna go ahead and we're gonna do the hearing test. So I'm gonna whisper a word into each ear, and you tell me what I said, okay?
Dog.
Okay.
Dog.
Okay. So hearing is equal in both ears. All right, so now what we're gonna do is I'm gonna check your nose now. So I'm gonna have you cover up one nasal for me. All right, and I'm just gonna shine up, look up for me a little bit so I can look up. Okay, so there's no obstruction noticed there. Nice drainage. Can you breathe in for me? Okay, is that, breathe out? Okay, and let's do the other side for me. All right, so no obstruction notice on this side. Can you take a deep breath for me in? Okay, good. Did you notice any difficulty breathing on either side?
No.
Okay, good. All right, so now we'll go ahead and we'll check your mouth now. Have you open your mouth for me? All right, so her mucosa is nice and pink, moist. Have you stick your tongue out for me? Say ah.
Ah.
All right, hold the tongue, and then I use my tongue depressor and hold the tongue down. Uvula is nice and midline. Open your mouth again. We're just gonna check your teeth now. Smile for me. And I'm just paying special attention to the gum line, which is nice and pink. And then normal limits here. She has good oral hygiene. Okay, so now we're gonna move down and we're gonna check around the neck area. So I'm gonna just palpate around here. Okay, checking down into her lymph node area. All right, so let's check her trachea now. Nice and midline. Can you swallow for me? Okay, did you have any difficulty with swallowing?
No.
Okay, so so her swallowing is nice. We noticed that she does wear glasses, so we know that she does have vision problems. You can go ahead and put your glasses back on. These are corrective lenses for her. So that will complete her head, ears, eyes, and nose and throat assessment. Thank you.